Alright, so we're going to be doing a thumb spica cast today. This is usually for like a scaphoid fracture over here or extreme distal wrist fracture. The way that the cast will look is pretty much encasing the thumb in fiberglass. And the way I describe patients to kind of hold their hand is like they're holding a soda can or something like that. And so they pretty much want to make a C with their hand. And then in the same position here, two things you'll need is still the stockinette, and then I usually use a 1-inch stockinette for the thumb, just so it's a little tighter around the thumb here. And then I just kind of cut through here, and then place this over his thumb. Again, patients always going to be moving in terms of keeping their C, so you have to be aware of that as you're casting to make sure that they stay within that same mold or shape. Okay. Like with all the other casts, I always start at the wrist here and just kind of wrap around, making sure you get that 50-50 roll and just keep on rolling. The difference here is when you get to the thumb, I usually go straight up to the thumb to make sure you're wrapping the thumb. And then I usually do 2 rounds around the thumb here. And then I work back down towards the distal part of their hand. And then making sure you stop at the MCP joint. And then going around the web space here. And once you get those 2 layers there, just work your way down. Again, you can pull as tight as you want with the web roll, because if you're pulling too tight, it will just end up ripping, which is fine. Because you do want this part of the cast to be nice and snug. Again, go ahead and relax your arm there. At this point, the only things left is to do the bumpers. Again, always want to bumper down at the forearm here. And you'll want to bumper at the MCP joints. And then you'll just want a small bumper around the top of the thumb here too. And that's just more so to make sure there's enough padding, because this web roll will start to thin out. And then once I get this, you don't want too much padding at the thumb. At this point, I just cut this in half for the most part, and that one kind of messed up. You can also just cut in half this way. Like that. So there's the base of the cast here. Next steps are the fiberglass. Again, with fiberglass, as soon as you open up the packaging, that's when the material will start to harden. If you're new at casting, I would just say to start wrapping as soon as you remove from the package. If you wet the fiberglass with water, it will harden a little bit quicker, so that's what we'll be doing right now. So again, always start at the wrist and roll away from you. And then same thing like with the web roll, just keep on rolling until you get to the thumb, and then just go up. If the patient's thumb is a little bit smaller, you'll have to make some cuts here so you can get enough space. So right now I'm just making a small cut just to ensure that I'm getting the whole area. Again, you want to go a little bit lower than your bumpers because you'll be pulling down on the stockinette in a little bit here. And then you just want to do 2 rounds of the material at the end here. And at this point, that first layer is done, so you won't pull down on all your stockinette here. I'll make a small cut on this end to help capture the thumb a little bit more. And if your stockinette's long like this, you can just trim it. You don't want it too long. Makes it difficult to remove the cast later on. Alright, so there's that first layer. You can start to just mold a little bit here, just because the material will start to get hard. The molds you're doing are, you do want to make sure that the thumb is kind of protected, and so I usually do like a diamond pinch around the thumb to make sure that it's secure. You're just making it, like just pinching this way to get like a diamond. And then you still want that palmar crease, and so you want to grab their hand like you're arm wrestling, and then also support the back, because hand neutrally will look like this a little bit. You don't need to fully extend their arm or fully flex, but neutral hand kind of looks like this. And so you just want to kind of make that same mold. Other mold is the interosseous mold, and at this point you're just squeezing down between the radius and ulna. But again, there's only 2 layers, and so we'll still need another layer of fiberglass to make sure that it gives more support. And start at the bottom here. And I do 2 layers again, and then just work my way up. Still trying to do the 50-50 roll. So when you get to this point, I just go straight for the thumb. And for this cast, for other casts like a short arm, you would typically want to fold here, but for this one you don't need to fold as much because their thumb is enclosed, and so that's usually the wear point of that cast. But you do want to make sure you capture it at the bottom here. And then just roll down. And then with cast, I normally try to end on this portion of the cast because it's less likely to rub against any clothing or just scratch your face if you want to sleep on your arm or anything like that. And so that's pretty much the cast. To make sure it hardens a little bit quicker, you can get some water and just kind of, you want to rub on the end piece of the cast because that helps kind of mold it. Or sorry, helps seal it. And so at this cast, again, do that diamond pinch at the top here. Depending on where the fracture is, sometimes you do want to have it a little bit higher than I do for the thumb if the fracture is like in the thumb, so it has more of a bumper. We'll say his fracture is a little bit lower, which is why it's short. And then again, you want that palmar crease and the inner osseous here. And pretty much you just keep on molding until the cast stops giving, basically. So things I normally tell patients, I usually do this when I'm molding just because there's a lot of squeezing. I usually tell the patients kind of the safety protocols for the cast. I usually tell patients at this point that the cast is going to feel fairly snug. That's how it should be. It should not feel tight though. The snugness should kind of loosen up after 24, 48 hours. That's when the Weber or the cotton starts to thin out a little bit more, so it should feel a little bit more comfortable at that point. If at that time it still feels fairly tight, losing feeling in the fingers turning blue, I always recommend sitting by the kitchen table and just having the arm up to help with any circulation. And if it's still not improving, that's when I would say please come back. Cast might be put on too tight, and it would need to be taken off and replaced. Other safety things for cast is cast cannot get wet. The outside, the fiberglass is waterproof, so that's fine if it's just like drizzling outside. You don't need to put a cover on it. However, if the inside cotton gets wet, it will just stay wet. The moisture will be locked in, and you have a risk of maceration and increased infection if it stays wet. So usually within 24 hours of it getting wet, I would recommend going back to the clinic, go to the ER, try to get the cast off, get a new one on. For showering, you can also look onto cast covers on Amazon. I just recommend putting in a garbage bag, putting some rubber band or tape at the end, and then always showering your arm up because it will go past the seal if your arm is up. If it's a leg cast or anything like that, I recommend sitting in the shower, bring like a chair or something, and then leaving your leg up if you can. Other things, if cast gets itchy because it's a lot of sweat, it's usually because of sweat, you can hit the cast like this to help with any of the vibration of the hairs. You can get a massage gun and light kind of palpation with the massage gun can help. Sometimes a hairdryer with a cool setting, you can blow cool air through here or here because it's usually because of sweat. Other things is if the arm is itchy here, you can try to trick your brain to scratch your other arm to help with any itchiness you might be experiencing. With the cast starting to harden up here, I usually tell patients as well that no leaning on this arm for the next 24 hours, because while the outside may feel hard, the inside is still hardening, and so if they're leaning on their arm a lot, it could cause to shift the mold. So as you say, the next day you can start doing anything you want with the cast, as long as it does not cause any pain. If it causes pain, I would just recommend not doing that, basically. But yeah. This is a thumb spica cast. Again, any fractures of like a scaphoid fracture or really distal carpal fractures or anything like that. And that's it. The other things you always want to note is you want at least 2 or 3 fingers of space between the bottom of the cast to the antecubital fossa, and then you can maybe fit a finger in here. That's usually how you know it's a good tightness. That's pretty much the thumb spica cast.